So today we're going to dive into the incredible science behind a drug that honestly makes modern surgery possible. It's a single molecule that's responsible for creating absolute controlled stillness right when it matters most.
You've probably wondered about this, right? If you or someone you know has had surgery, how do they keep a person perfectly still? We're not just talking about big movements, but those tiny little involuntary muscle twitches we all have.
Well, the answer is kinda dramatic. It's a state of carefully controlled, temporary, and fully reversible paralysis. It sounds a little scary, I know, but it's actually a cornerstone of patient safety and surgical success.
And this gets us to what anesthesiologists call the surgical stillness problem. Because when a surgeon is working with tiny blood vessels or delicate nerves, even the smallest, most microscopic movement can be a huge issue.
I mean, think about it. If a surgeon is operating on your abdomen, even the natural tension in your muscles can get in the way. Or imagine a patient on a ventilator in the ICU. Their body might instinctively try to fight the machine's rhythm. So achieving this absolute stillness isn't just a nice-to-have, it's an absolute necessity.
So how do we solve this problem? Well, let's meet the hero of our story, a drug called Vecuronium. It's an incredibly elegant solution to this need for deep, profound muscle relaxation.
Okay, that's the official definition. Let's break that down real quick. Neuromuscular blocking agent just means it works right at the spot where your nerves talk to your muscles. And that non-depolarizing part, that's actually super important. It means it blocks the muscle smoothly without causing a little twitch first, which is exactly what you want for controlled relaxation.
You know, this slide tells such a fascinating story about medical innovation. Vecuronium is basically a refined version of an older drug, pancuronium, and the only difference between them is the removal of a single methyl group. That's just one carbon atom and 3 hydrogen atoms. But that tiny change has a huge impact. It gets rid of the older drug's tendency to speed up the heart rate, making Vecuronium incredibly stable and gentle on the cardiovascular system. For a patient who's already under the stress of surgery, avoiding any extra strain on the heart is a massive leap forward in safety.
Okay, so how does it actually do this? To really get it, we need to zoom way in to the microscopic level. You have to picture this tiny molecular battle that's happening all over your body, a fight for control over your muscle receptors.
So here's how things normally work. Super simple. A nerve sends a signal. This releases a chemical messenger called acetylcholine, or ACH. When that ACH locks into its special receptor on a muscle cell, it's like a key turning on a lock. It opens a channel and boom, the muscle contracts. It's elegant and it's efficient. Now here comes Vecuronium, crashing the party. When it's given through an IV, its molecules flood that little gap between the nerve and the muscle. And they're shaped just enough like acetylcholine to fit perfectly into those receptors. But, and this is the trick, they don't activate them. It's literally a game of musical chairs at a molecular level. Vecuronium gets to all the chairs first, leaving poor acetylcholine with nowhere to sit. The music stops, and the muscle simply cannot contract.
And there's a really cool scientific term for this process: competitive antagonism. Vecuronium and acetylcholine are competing for the exact same spot. And that word competitive is everything, because it means the battle isn't over for good. It implies that if you could somehow change the balance, if you could flood the area with way more acetylcholine, you could actually win the competition back. And that's exactly how we reverse the effect later on. All right, so let's zoom back out from all that microscopic action and see where this incredible science gets put to use every single day in the hospital. You'll see it used in a few absolutely critical situations. It's perfect for relaxing the jaw and vocal cords to place a breathing tube, which is called intubation. It provides that perfectly still surgical field for all sorts of operations. And in the ICU, it's a lifesaver for helping critically ill patients work with the ventilator instead of against it. And wow, does it work fast? After it's given intravenously, Vecuronium takes full effect in just 2 to 3 minutes. That allows the medical team to get control of the situation quickly and get to work.
A standard dose will give you about 30 to 40 minutes of muscle relaxation. This intermediate duration is kind of the perfect sweet spot for anesthesiologists. It's long enough for a lot of common procedures, but not so long that it becomes hard to manage or reverse. It gives them precise control over the whole process. Now, this might be the most important part of the whole story. I mean, creating paralysis is one thing, but how do you safely, reliably, and precisely turn it all back on at the end of the surgery?
Remember that competition we talked about? Well, this is where the comeback happens. The problem is that vecuronium is sitting in all the receptor chairs. So the solution is to just overwhelm it. You dramatically increase the amount of the body's own messenger, acetylcholine, so that by sheer numbers, it can push vecuronium out of the way and take back control.
So how do doctors do that? It's genius, really. They use drugs called acetylcholine esterase inhibitors. See, your body has a natural enzyme that acts like a little cleanup crew, constantly breaking down acetylcholine. These reversal drugs basically just tell that cleanup crew to take a coffee break. With the cleanup crew gone, acetylcholine levels skyrocket, they easily win the battle for the receptors, and muscle function comes right back. It's an incredibly elegant biological switch. And this quote really says it all, doesn't it? Vecuronium is a cornerstone of modern anesthesia. It's not just about creating stillness, it's about doing it reliably and with incredible stability, so doctors can pause a fundamental biological function and then, just as importantly, bring it back precisely when they need to.
It really makes you think, doesn't it? Every single day, complex molecular battles just like this one are being fought and won inside our bodies, all carefully managed by medical science to keep us safe. What other amazing, invisible processes are out there, quietly making the impossible possible?